All right, so you're coming back to see us. You like us. That's great. So we're really excited to have you in for kind of your biannual or semi-annual overall health assessment. So at this visit, it's a lot like the new patient visit, but obviously much shorter because we know you already, and hopefully you know us a little bit. So this visit's really important to keep things going as far as the overall plan that we've made for you. One of the greatest things about dentistry is seeing patients over their lifetime. When I grew up, my dentists, it would always be so fun to go in because they'd ask me questions about my family, about school, and I was always impressed, like, boy, I barely see these people and they know so much about me. They made me feel so comfortable. And now that I've been a dentist, I see that. It's so fun to see people over many months or years as they grow older. Kids grow up bigger. People's jobs, they get more experience, their jobs change, they have no kids, lots of stuff happens in your life in 6 months or so. And so we're really excited to see how your life is changing and how things are going for you. So one of the big parts of getting a good assessment of your health, with your teeth, with your gums, and how that relates to your overall health is obviously some x-rays and some photos. So at this visit, we don't have to do as many as we did on our first visit, but we'll take the necessary ones that we need to make sure that nothing's creeping up on us and that everything's going okay, and also that any treatment that we've done is still looking great. One of the things that we want to obviously avoid is big problems, and these visits to recheck things is very important to do that for you. And so the smaller we can keep things, the longer they're going to last and the more predictable they're going to be. So as you know, because you've been in the office, we use digital x-rays. And while that is some exposure to radiation, the digital x-rays use such little radiation these days that every few times a year it's perfectly safe. And if you have any questions about that, feel free to ask us. We want you to be fully comfortable with what we're doing for you, and so that we can provide an honest and accurate assessment of what's going on. So after those x-rays and photos, if we need to do anything about anything, we'll let you know. Say, hey, you know what? A cavity's crept up on this tooth. We should take care of that before things get any bigger or any worse. Or maybe something's changed in your bite, or we're noticing something, or maybe we'll just talk about how great things are and how good things look in there. How about that? And then what we'll do is we'll most likely get your cleaning done today. I'd expect this visit usually takes around an hour. We'll get down with our hygienist. You'll sit down with me for a little bit. And if it's been a year, we'll do our oral cancer screening just to make sure everything's going well on that as well. So really looking forward to you coming in. Thanks for trusting us here at Parker Dentistry. And once again, say cheese.